Welcome back to Cheddar Health and Wellness in partnership with Walgreens. We're in this together. According to the CDC, 6 in 10 Americans live with at least one chronic disease. And when it comes to managing these conditions, technology is totally transforming the way we provide care. Joining us to discuss is healthcare market analyst Seth Denson. Seth, thank you so much for joining us.
Hey, it's great to be with you.
So first up here, who are we talking about when we talk about chronic disease, and how is technology helping us to manage these chronic diseases?
Well, yeah, chronic disease is obviously people with ongoing conditions that are known. You've got heart disease, diabetes, and so on. And what technology is really playing a vast role is in engagement. So one of the ongoing challenges we've always had with chronic conditions is adherence to treatment. And that treatment may be medication, it may be understanding what's going on in your human body, the ability to coordinate care with a doctor. I mean, we've come a long way since technology started its role in 1958 with a pacemaker. And certainly as we see technology playing a bigger role going forward, it will continue to advance how we care for people with chronic conditions.
Oh my gosh, adherence to medication is huge when it comes to my grandma and taking care of her. But we've also seen the rise of things like wearables and tech being big on helping patients to monitor treatments and medications. So how is that happening and unfolding during the pandemic?
Well, there's a couple of things, right? I mean, we've come a long way also since Help I've Fallen and I Can't Get Up buttons, right, that we all remember. In so much that your smartwatch will now tell 911 operators that you've fallen and you can't get up. But it's also checking things like your blood pressure, your heart rate. We're also seeing integrated insulin pumps and glucose monitors that as you're testing your A1Cs, it will actually send that message to your clinician if it's seeing something maybe off kilter or out of the norm, and even so much as, it's kind of gross to talk about, but integrated colostomy bags that are sending temperature and flows and everything to clinicians. And again, this is huge when trying to manage chronic care, to have that level of engagement when the doctor or the clinician can sense something may be going on that needs to be addressed.
I was just about to ask you that. So how are these types of tech helping doctors to better understand and treat their patients with chronic conditions, especially during this time when we've seen our healthcare providers and services so slammed by the pandemic?
Yeah, so part of that is obviously, given COVID-19, there's limited resources and time to make sure that we're getting to people. And so certainly wearables are playing a role there. But it's also helping doctors in managing what we would call outliers, right? The human body is uniquely different for everybody. And so one person's resting heart rate, for example, might be different than someone else's. And you've got a lot of things that are playing a role in that. And what wearables allow the medical community to do is track trends and outliers so that they can better manage care and again start to identify when there is a challenge specifically for someone who, because of the pandemic, they can't get to as easily.
Seth, I also want to ask you about telehealth during the age of coronavirus. How is this particularly useful, especially to those with chronic conditions?
Yeah, by some estimates, we've seen roughly a 60% increase in telehealth utilization, and I'm pleased to see that. In the United States today, we are starting to see a shortage of primary care doctors, and so the ability to make sure that our primary health providers are able to spend adequate time with people, not only with chronic conditions, but things like cold, flu, sinus infection. These have been greatly impacted as a result of coronavirus, where we kind of have an all hands on deck scenario. And so what telehealth is really allowing our clinical community to do is be much more efficient and effective with their time and be able to get to more patients, especially when you consider that we have a big chunk of our community that lives in rural areas where we don't necessarily have a wide opportunity of primary care accessibility.
And Seth, I just have like 30 seconds left with you, but I have to ask, how is telehealth helping to minimize the cost of care?
Yeah, so a recent study by the VA showed that when telehealth could be utilized, that we saw a roughly 19% reduction in admissions, and of those admissions, roughly 25% reduction in the number of days. And so what telehealth is allowing the community to do is engage with those chronic conditions, identify those that need to be seen, and again, preventative medicine is a key piece here. It's getting people on the front end of the care that's needed.
Seth Denson, healthcare market analyst. Thank you so much for your insight and for joining us here today on Cheddar.